Wow, what an introduction. What can I say? I'm so honored to be here tonight to receive this Jimmy and Rosalynn Carter Award. Following 21 previous awardees, President Carter has done so much for global health. And in fact, he was advised by two previous awardees. One was Bill Gates, who advised him on global health. And Bill Foege advised him, and then Bill Foege also advised Bill and Melinda Gates, other awardees. And it was Bill and Melinda Gates who came forward and have really supported the global rotavirus effort before we had any funding. So I'm delighted to be here today and representing two former awardees who have done so much. Also delighted to share the podium tonight with Drs. Ann Schuchat and Kathy Edwards, two good friends, accomplished scientists, and public health heroes. And Ann and Kathy are living proof that women do hold up half the world in science and in life. Stand up. Also, delighted to have my wife here and my son, Andy. My wife, I met her when she was 19. Most wonderful partner for all these. She's followed me, dragged her around the world, and she's had an extraordinary career on her own. First as a pediatrician, now as the dean of a medical school. And Andy Glass, my son, an upcoming medical student this July, representing Andy. Stand up, Andy. Andy's representing my other two children, my daughter Nina, who's a trauma surgeon on call tonight, and my son Michael, who's in Berlin, a computer geek. My road to research was a little bit like Dorothy going down the yellow brick road to see the Wizard of Oz. That road has been unplanned. I've been challenged by regular disasters, bolstered by serendipitous encounters and meetings, global adventures, but resilience, all tempered by the support of amazing friends, old and new. I never considered a career in research, and back in medical school, if you would have told me that I would spend 30 years of my life working on the most disgusting disease in the world, diarrhea, I would have said, no way. I joined CDC in 1977 as an EIS officer and investigated a dozen outbreaks, things that ranged from infertility in Chicano pesticide workers in California to starvation from famine in Zaire and outbreaks of deaths from the tornado in Wichita Falls, Texas. But after investigating a single outbreak on a cruise ship infected with salmonella, Roger Feldman, my division director, offered me a position to spend 2 years in Bangladesh to conduct a trial of a new cholera vaccine. I wasn't really sure why Roger Feldman wanted to send me so far away. But never having seen a case of cholera and never having conducted a clinical trial, I said, sure, I'm your man. So Barbara and I went off to Bangladesh sight unseen and spent 3.5 incredible years. Now, Bangladesh, if you remember, is one of the poorest countries in the world, was still recovering from a civil war. The move gave us an amazing opportunity to take science where the problems are, and diarrhea was the #1 cause of childhood deaths at that time. They needed simple solutions to address their problems, and a decade before, David Nayland and Richard Cash had demonstrated the life-saving value of oral rehydration therapy that could prevent diarrheal deaths in the field, saving 1 million lives a year. And I realized from this that even research in Bangladesh could have incredible relevance for the United States and for the world. So that was my start. I ended up in the guest house with Jan Holmgren and Anne-Marie Svennerholm, two giants in vaccinology, all by serendipity. And while we were there, in the first 3 months of being in Bangladesh, my vaccine trial was canceled. There I was, disaster, sitting there with no project, but with the CDC remit. And it was with Jan that we said, well, let's work on your next vaccine. And that's the vaccine that's in the world today and being used in Haiti and some of the other epidemics. So it was really by serendipity that I got to work on cholera and continue my interest in vaccinology. Now, when I returned to the U.S., and while I was there, I found that this experience in Bangladesh was incredibly insightful, and I was following the experience to be there to work really challenged me and changed my career direction to work on diarrheal diseases. That experience was very much like the experience of Bob Black and Mike Merson and George Kurland and Bucky Greeno, all of whom ended up as giants in global health. So I think that's one of the lessons I learned, and I took back to Fogarty, where I am now. Now, while I was there also, my wife Barbara set up this surveillance system, and while I was there thinking that cholera was the most important diarrheal disease, rotavirus was much more important. And it was that observation that really shifted me from cholera to rotavirus. Well, I came back to NIH, and I started working, and I met Dick Krause, who assigned me to work with Al Kapikian, a great mentor in rotavirus. Everyone in rotavirus knows him well. And he was an incredible mentor, and I really learned so much in molecular biology. I went from living on a barge in the Ganges Delta to an NIH laboratory. And it was that connection that was so important for me. Well, I went back to CDC 1986, and for 20 years had the most incredible run of luck and discovery doing both epidemiology and laboratory science. We had a steady flow of EIS officers, postdocs, and we discovered 6 new viruses in 6 years, all enteric viruses. And it was really an amazing time, and we really were thinking about the future of rotavirus vaccines. Dr. Kapikian's vaccine was licensed in 1998. It was a huge benefit to all, and we were immediately able to put this through the ACIP recommendation for all American children. It was the high point of my career. Bill Gates asked me for dinner with Melinda when he was thinking about investing in vaccines, and it was that dinner where he decided that rotavirus was the first vaccine that he put into the Children's Vaccine Initiative with 3 others. And so we really got a boost from Bill Gates that really propelled this activity. Well, as soon as we had that success, intussusception came. We lost the vaccine. The vaccine was pulled, a rare adverse event. The vaccine was pulled. 15 years of research down the drain, another disaster. And over the next 7 years, waiting for new vaccines to come, we set up global surveillance in over 45 countries and trained people to be prepared when the next vaccines came. Well, they came seven years later, 2006. Paul Offit sitting here with the Merck vaccine, the GSK vaccine at the same time, and those have gone in now to over 82 countries. But vaccine price is a key determinant of use in the developing world, and it's in the developing world that the disease causes death. And therefore, we tried to figure out how we could get vaccines for lower price. 1985, I met M.K. Bond, Maharaj Bond in India, young pediatrician. We were housed in a convent in Calcutta. What do you do in a convent at night? 2 guys. We go out for a drink, and in talking about rotavirus, he had this observation that newborns in his newborn unit had rotavirus but didn't have symptoms. And over the next 30 years, we've worked together to develop this neonatal strain as a vaccine. Now, how do we develop a vaccine without a manufacturer? Well, this was a project of the Indo-US VAP. I'm looking at Tony Fauci because it was your program that got us together, Tony, with George Kurland, director. And they organized a meeting, and at this meeting, I met this character, Dr. Krishna Ella. First time, and he said, I want to make your vaccine. I said, Krishna, have you ever made a vaccine? He said, no, I'm working on one. I said, have you ever worked with viruses or cell culture? He says, no, but I can do it. But his enthusiasm and his commitment was contagious. And over the next 15 years, we worked together slowly to make a vaccine, and I've seen him thrive in doing this. Now his vaccine, I believe, is in half the states of India, 45 million doses sold. It's pre-qualified by WHO. It's going for UNICEF and Gavi tenders. So it's really going to be the lowest price, but similarly effective vaccine in the world. It's going to be the vaccine that really makes an impact on deaths in the developing world. So Krishna, I have no invested interest. I have no conflicts of interest. I've never taken a penny from Krishna, but I'm so indebted to what he's done for the rotavirus field. So that's Krishna. In 2006, I was offered the position as the head of the Fogarty International Center at NIH, and by that time, we had vaccine in the United States, and it was already making an impact to decrease hospitalizations. My one conflict of interest, by the way, is with my wife. She was chair of pediatrics at the time. Her bottom line was to keep the hospitals filled, and we deprived her of 5% of her income from those patients with diarrhea that came by every winter. So thank you, Barbara, for accepting me. But in 2006, I was offered the position to go back to NIH, and I realized I had such wonderful people at CDC, and Umesh Parashar in the epidemiology group, John Gensch and Baoming Jiang in the laboratory, that I thought it was best to let them fly on their own, but keep an eye on them. So I'm still a guest researcher at CDC, and they've done incredibly well. So over the past 30 years, diarrheal diseases have gone from about 4.5 million when I started this endeavor to about 700,000 deaths a year. It's been an incredible improvement globally. And still, a third of those diarrheal deaths are from rotavirus. So we still have a long ways to go. And rotavirus is in 82 countries, so there's a lot more to go. The Fogarty Center has given me a chance to promote the training of young people, and this is what I did so nicely at CDC, both laboratorians and epidemiologists. And I think that these early research experiences of young investigators can really change their careers and glom them onto a direction like me for diarrhea that I never would have thought about had I not had that experience. It's been compelling. It's gotten me introduced into all sorts of people. And I was so amazed in 2015 when the Prime Minister of India, Prime Minister Modi, 6 weeks after he took his position, said that all children in India would be receiving a rotavirus vaccine. And he personally launched this vaccine in India. So Krishna has been able to do things that no one else would have been able to do with Rajban and the entire group. I have so many people to thank here. I won't begin to go over them because this is not something that's done alone, but clearly the group, I really can accept this honor, this award, really on behalf of the CDC group, the viral gastro group that's done so much and continues to be the leaders in global health research on rotavirus. My colleagues in India, Rajban, Krishna Ella, the whole team that developed this vaccine, and the community of rotavirus researchers, including Paul Offit right here, Phil Dormeister, and many others who have really made this, taken this on as a global endeavor. I really thank the foundation for your wonderful award and the honor of receiving.